So before watching the video, I just want to give a quick heads up. Since most of the video was recorded with the camera flipped on selfie mode, a lot of the things I do are in a flipped direction. So for example, in the video I'd be saying that I'm gonna check the right leg or do an MMT on the right leg, but because the camera's flipped, it looks like I'm doing it on the left leg. So I just wanted to give a quick heads up for that. Hi, my name is Lawrence. So for this video assignment, I'll be performing an assessment for an injury that's potentially in the hip area, at the hip joint area. Okay, so what brings you here today? What's the main complaint that brought you here?
So during the summer, I was putting on a sock or shoe, I forget exactly, and I happened to go into like this motion here, like this, and that's what, and then I got a sudden pain in my glute area that kind of traveled down to like the mid-thigh and stayed there, and yeah, it was causing me a lot of pain throughout the summer.
Okay, so it seems you went into a flexion and external rotation motion, and that pulled on something. All right. Yeah. Ed, have you had this checked out by anyone else?
Yeah, I had it checked out by a physio, and they noticed that I had a lot of tightness everywhere. So like in my quads and my hamstrings and my piriformis, my glutes I think were also weak, and I had and my core also was weak, and that's what they've noticed. Also that I had a bit of like dural tension as well, and yeah, so like with the exercise that they prescribed me, it went away, and now it kind of restarted again.
Okay, so you said they gave you exercises. What kind of exercises have they given you?
So it was usually like hamstring stretching, quad stretching, piriformis stretching, TVA activation, and flossing was also another thing that they gave me.
Okay, perfect. Have you had any previous problems in that region?
No. Besides probably a bit of hip snapping, but other than that, I don't really pay much attention to it.
Okay. And is there any like other kind of injuries that I should be aware of?
No, I haven't had any other injuries, no.
Okay. Any previous surgeries?
No surgeries, no.
Okay. And in terms of noise, you said you did hear a bit of snapping at the hip. Is there anything else that you've noticed in terms of noise, like a crepitus or like cracks or pops?
No, there's no noise at all. There's just the occasional like clunking when I bring my hip, when I flex my hip, and sometimes when I go into extensions, you hear it.
Okay, perfect. And in terms of like the visual aspect, have you noticed any like redness or swelling?
No,
any abnormalities in the area?
No, there's nothing of that kind. No.
No. Okay. And has it like altered or changed certain things that you do on a daily basis, or the way you have to move your leg? Do you feel?
Well, I got to be careful when I have to put on socks. So now I kind of just try to go into like more of this like pure hip flexion instead of adding that rotation. When I try to lift, I wasn't lifting properly, so now I kind of try to brace myself when I lift. So that's more the things I've changed overall.
Okay. And what provokes the pain exactly?
It's again trying to put on like socks, pants, shoes, especially when it involves this. Standing for long periods of time sometimes triggers it, and also when I'm seated for long periods of time, that also tends to trigger it.
Okay, and what alleviates the pain?
Usually walking, lying down, but standing, I notice it still stays, especially if I'm stationary for about an hour or two, like depending, because my work demands it. So that's when I starts to like pick up again.
Okay. So from what I understood, just to be sure, you said the pain radiates. It's not just locally in one spot.
It's like starts up here, like higher up in the pelvis, and it kind of goes down like mid-leg and kind of stays there.
Okay, so from the pelvis to all the way to the back of the thigh.
Here, yeah.
Okay, understood.
And is there like a specific time of day that like that you feel that the pain is triggered more
Like
often than other?
sometimes in the morning I'll wake up and I feel like yeah, it feels you feel a bit of no, sorry, I'll feel a bit of pain in the morning, and after work sometimes it'll like on the days that I do work I'll feel a bit of pain as well.
Okay. Also, like in terms of sleep, what's your sleeping position?
I move a lot. So sometimes I sleep in a fetal position, sometimes I'm on my back, sometimes I'm on my stomach. So I really move a lot throughout the night. I can't really say I stay in one position.
Okay. And how old's your mattress?
It's about 2 years old.
Okay. And how many pillows do you sleep with?
I sleep with just the one on my head, or
Okay.
for my head.
Okay. And you sleep with any pillows between the legs?
No, no pillows between the legs, no.
Okay. So also what I wanted to ask you is how old are you?
I'm 30.
Okay. And what do you do?
I'm a student full time, and I work on the weekends.
Like on the weekends, okay. And do you find like when is there any movements that would at work that would trigger the pain as well?
Yeah, so standing for a long time, sometimes lifting stuff could trigger it.
Okay.
Sometimes like some movements that require me to like kind
Okay.
of like go and like really move my hips a lot. And that's about it really at work.
Okay.
And sometimes when I'm seated on break, sometimes it hurts.
Okay. And so you said you're a student, so I'm guessing, especially now with the homeschooling, you spend a lot of time seated.
Yeah.
At home, yeah.
And sometimes that could trigger the pain as well. I'll feel a bit of pain after getting up.
Okay. And is there any allergies that you have that I should be aware of?
No, none.
Okay. Any medications that you take?
No.
No. Okay. And overall, your general health?
Stressed, anxious. That's about it.
Okay. And any family history I should be aware of?
My mom has degenerative disc disease, but that's about it.
Okay. Or else, like you yourself, you live a healthy lifestyle?
Somewhat. I'm very sedentary, so and more or less inactive. So, but I eat well. I don't smoke. I don't drink.
Okay.
So I guess that's overall healthy.
All right. And your limb dominance?
Right-handed, right-legged.
Okay. Now, it's in terms of sports, like, because you said you're pretty sedentary, so you don't do any sports at all?
No.
Oh, okay. And any other like forms of physical activity, like training or jogging?
I used to train, so I would do biking, stationary biking for about half an hour, and then that stopped once I started to get pain in my leg or in my butt.
Okay, and how long ago was this the stationary
This was
biking?
probably in July, August, which was more or less. I had started before that. Started in June, had to stop in August because of the pain.
Okay, and
I never went back.
understood. And so, in general, your day, for the most part, in terms of activities of daily living, it just comprises of sitting and walking here and there.
Yep.
Except for when you're at work, that's when you move around
That's
a
when I
little
do
more.
my most walking. Yeah, my most physical activities. I work on the weekends.
And yeah, so I'm just gonna ask you some questions related to red and yellow flags. So, have you noticed like a loss of appetite?
No.
No. Okay. Any like a dizziness?
No.
Nausea, vomiting?
No.
Okay. Night sweats?
No.
Any issues with balance?
No.
Okay. Saddle anesthesia?
No.
Vertigo?
No.
What about drop attacks?
No.
Okay. And just like some other extra questions I want to ask. So the pain, is it, do you feel like it's more superior or really deep?
No, it feels pretty deep.
Deep, okay. And the quality of the pain?
It's just sharp. It's usually a sharp. And sometimes it's dull, but then a movement could like make it sharp.
Okay, perfect. Dull and sharp. And Do you sometimes feel any like numbness, tingling, or burning?
No. Sometimes burning, but that's about it.
Okay. And the severity of the pain, so on 10, how would you rate it?
It's probably a 4 or 5.
4 or 5. Okay.
Probably at its worst, it's like maybe a 5, and at its best, it's like a 2. So between 2 and 5, sometimes it varies.
So, and I'm guessing it's at a 5 in the morning because that's, you said it's like really triggered. In
Yeah,
the
and
morning
after
when you do those.
Yeah,
Sorry, go ahead.
and then after work as well, also.
Okay, perfect. So, based on all these questions, I feel like for my disease of suspicion, my first one's going to be sciatica. My second is going to be a glutamine tendinopathy. And my third one would be piriformis syndrome. Okay, so now for observation. For the anterior view of the posture, I do notice a bit of external rotation of both feet, however more on the left foot. I do notice as well a bit of elevation of the right shoulder. So now if we look at the side view on the right, so if we just turn for the right side, or the left side. Okay, so we'll do the left side. So I do notice a bit of upper cross syndrome. So like a bit of neck extension, some rounded shoulders. And even if we go on the right side, just if we rotate towards the right. Okay, so even here I notice a bit of the same thing, the forward head posture going on. The plumb line isn't intact. As well, I do notice in terms of the spinal curvature, a bit of sway back going on. And now if we just have a look at the posterior view. I do note again some external rotation going on at the feet, especially the left foot, and as well some elevation of the right shoulder. As well, I do notice a bit of prominence in the scapulas, especially the right one. So now I'm just going to have a look at the ASIS, PSIS, iliac crest, and the ischiotuberosity, just to make sure that they're all aligned. So here, just back up a bit. Okay. Good. So checking for the ASIS here. They seem aligned. I'm just going to pull the shorts down a bit to get a better idea. Okay, those seem aligned. So you could bring them back up. So I'm just going to check for the iliac crest. Those seem aligned as well. Now if you could just turn. I'm going to check the PSIS. I'm just going to hook a bit underneath. PSISs are aligned, and I'm going to. Okay, so now we're observing gait, and from what I notice, I do notice that the feet are externally rotated, and as seen before on the anterior view, there was a bit of head tilting as well. Also, again, I do see the right shoulder a little higher than the left. And if we look from the side view as well, feet are still a bit externally rotated. Feet are a bit flat and pronated as well. Okay, so next I'm going to have my patient doing some functional movements. So starting off with some glute bridges. So you can go ahead and start. So I do notice a bit of difficulty in being able to fully extend the hips. So you could give me a couple more reps just to show a better idea.
And one more. And he's even abducting the legs now a bit. So next, I'm gonna have my patient doing some walking lunges. So again, I do notice the feet externally rotating, having issues to control the movement. A bit of head tilting's being noticed as well. If you just look from the posterior view, you see the pronated feet even more. Okay, perfect. Next, I'm gonna have my patient perform a squat. So you can just go ahead here on the platform. Go from to the side. So again, the feet are pronated. We do see a bit of flat feet once again happening. I do notice potentially some genu valgum going on. And then finally, we're going to do some, I'm just going to have the patient do some simple going up and down the steps. So now what I'm going to ask you to do also, when you come back down backwards. And do the same thing. So again, I notice the head tilting forward as they're performing this, that the movement isn't exactly fluid. Okay, so in this video I'll be doing ranges of motion, so with the affected joint being the hip joint. Then I'll be doing clearing of the lumbar, the pelvis, and the knee. So we'll start with lumbar. So I'm just gonna ask you to flex forward. Perfect, with lower pressure. How's that? Good. Perfect. Extend your back now, like so. Put a bit of over pressure. How's that? The tissue stretch. Now side bend away from me. Perfect. How's that? Tissue stretch. Side bend towards me. How's that? Okay. Again, tissue stretch. Next, I'm going to ask you to rotate towards the left. Okay. How's that? Tissue stretch. Perfect. Now rotate away from me. Tissue stretch. Perfect. So now we're going to do some resistive ranges of motion. Flexion. 1, 2, 3, 4, 5. 5 on 5 strength. Go back to extension. 1, 2, 3, 4, 5. 5 on 5 strength. Side bend away from me. 1, 2, 3, 4, 5. 5 on 5 strength. Now towards me. 1, 2, 3, 4, 5. 5 on 5 strength. Now I'm going to rotate away from me. 1, 2, 3, 4, 5. 5 on 5 strength. Now rotate towards me. 1, 2, 3, 4, 5. 5 on 5 strength. Perfect. Now we're going to do the knee. So you could lie down on your back. Okay, so we're going to start with the unaffected side, which is the right side. So I'm going to ask you to just bring your leg towards you. How's that? Just keep it on the table. Lower pressure, tissue approximation. Now we're also going to do some resisting quickly. So bring your leg towards my hand. Perfect. 5 on 5 strength. Now, if you could just switch over to the other side. So we're going to do the left affected side, so bring your leg towards you. How's that? Okay. Over pressure, we have tissue approximation. Now bring your leg towards you. 5 on 5 strength. So now I'm just gonna ask you to bend your leg, your right leg, and extend it. How's that? Bring it. Okay, do some overpressure.
Good.
Okay. That's gonna be bony block. And now we're just gonna do some resistant range of motion. Push up against my hand. Perfect. 5 on 5 strength. Go up on the other side. Now extend your leg. How's that? Overpressure. How's that? Okay. We're just gonna move your leg up a bit. Bring it up towards my hand. Perfect. 5 on 5 strength. Now we're gonna do the hip. So what I'm gonna ask you to do, with both hips, bring them towards you. Some overpressure, tissue stretch. Now we're gonna do the affected side. That's good. Perfect. So that's both tissue stretch with the overpressure. So now going here. Bring it back up this one. So I apologize, we'll do that after. So yeah, so bring it back up. So what I'm gonna ask you to do is just lift your leg and rotate it towards me. Towards me. How's that?
Good.
So we bring it into internal rotation. We got some tissue stretch. Now bring it away from me. So again, we got some tissue stretch. We're gonna put over pressure and tissue stretch. That was fine. Perfect. Now we're gonna do the same thing here. On the other leg. So you're gonna rotate the leg away from me. Perfect. Into external rotation. That's okay. Perfect. Now we got tissue stretch.
Yep.
Now towards me. That's okay. That's good. That hurts a bit? Okay. That's fine. So we'll look into that after, into a passive movement. You can relax it. So next we're gonna do some abduction. So I'm gonna ask you to bring your leg out towards me. Perfect. How's that?
Good.
I do some overpressure. Perfect. We got some tissue stretch with that. Now I'm just gonna lift your leg, and you're gonna bring it into adduction. This one into adduction. Perfect. How's that? Hold on. We're just gonna do some overpressure, tissue stretch, and tissue approximation as well. So now I'm gonna ask you to bring this up into adduction. How's that?
Clicking.
You heard it clicking?
Yep.
Okay. Keep that there. If I overpressure it?
Yeah, it's still good.
Okay. So a bit of pain on that. And how's the pain on 10?
It's like
A 2?
a 3.
A 3? Okay. And on external rotation before?
It was like a 2.
2. Okay. And so we did that. So now we're gonna do resisted ranges of motion. So we're gonna start with the unaffected leg. So I'm asking to bring this leg in, get into flexion. Okay. So like that. Perfect. Now bring the leg towards you. Against my hand. Perfect. 5 on 5 strength. We're gonna keep it up. Now rotate it towards you. Towards me. Perfect. 5 on 5 strength for external rotation. Now for internal rotation, go ahead. Perfect. 5 on 5 strength for that as well. Now we're gonna do abduction. So bring your leg up towards me.
Perfect. 5 on 5 strength. Now we're going to do adduction. So bring it towards me. How's that?
Good.
Okay, 5 on 5 strength. Now we're going to do the affected leg. So flex your hip. Okay, push towards me. Towards you. Perfect. 5 on 5 strength. Now push towards me. That hurts a bit as well.
Yeah.
Also a 2 on 10 pain.
Yeah, it's about 12.
Okay, now rotate it into internal rotation.
Just like one.
Okay, perfect. But I did notice it was a 5 on 5 strength, however. So that's that. Next, we're gonna do abduction on this leg. So bring it, push towards me. Perfect. 5 on 5 strength.
That hurts a bit too. It's like one on. It's like okay.
Oh, but that hurts a bit.
Yeah, I like the 2 on.
Okay, 2 on 10. So now push away from me. Okay, perfect. How's that?
It's good.
Okay, so I'm just gonna do passive ranges of motion for the 2 affected ranges of motion, which were abduction and external rotation. So doing this on the affected side. How's that?
It's good.
Okay. Now I'm gonna bring it into external rotation for you.
It's good.
Okay, that's fine. Okay, good. So now I'm just gonna ask you to go on your stomach. So now we're gonna just check out hip extension bilaterally. So with this leg, I'm gonna ask you to bring it up. How's that?
It's good.
Okay. That's overpressure. So we got some tissue stretch. That's fine.
Yeah.
Okay. Perfect. And while we're here, we'll do resistant range of motion. So bring your leg up. How's that?
It's alright.
Okay. 5 on 5 strength. We'll also do glute max MMT while the patient's in this position. So bringing your leg towards you, stabilizing on the same side. And I'm just going to ask you to lift your leg up towards my hand. Perfect. 5 on 5 strength. Now same thing. So I'm going to ask you to lift your leg up. Just the leg. How's that? Sorry? Just, okay, there is a bit of pain, alright? So I'm going to bring that up passively, so relax. If I do that for you, how is it?
Good.
Okay. So now we'll do resistant, so push up. Okay, so that seems a bit weak. So I'm going to give that a 4 on 5. We'll also do the glute max MMT on the left affected leg. So again, patient bringing their leg towards them. They're going to lift their leg up a bit, stabilizing on the same side, and they're going to try pushing up against my right hand. Okay, so again, that seems a bit weak also. I'd also give that a 4 on 5.